The topic of this lecture is the coxal bones, or pelvic bones. Os coxa goes by lots of names. Here it is. They're paired structures. We're seeing the right side pelvic bone. And the femur, the head of the femur, is going to fit nicely into that acetabulum or hip socket. You also notice in the center of the structure is the sacrum, which is part of the axial skeleton. It's going to attach to the pelvis through this auricular surface that you can't see too well here. So here's the sacrum. Here's the pubis. The pubis is where there's a symphysis between the other side. So there's a connection there. You can see many bones. There's the obturator foramen. Ichium in the back. There's different notches, like the sciatic notch, that's going to allow blood vessels and nerves to pass through this area. Well, here it is. We're going to take our time as we go through this. Take a look at I mentioned the symphysis where the two join, and there's sacroiliac joint between the sacrum, which is here, down the lower right, sacrum, and the pelvis. Okay, so here's the axial skeleton. Pelvis is part of the appendicular, part of the legs, in this case, at least the leg connections. Let's move to the ilium, because you'll notice there's colorations in this bone, and that's because there's three regions. You can see here where it's kind of like the Mercedes car symbol. There's a separation up to the middle of the acetabulum, off to that'll be the posterior side. This is going to be the ischium. To the anterior side, the front, that's the pubis. Ilium here, iliac crest, muscles are attaching up here. This is the largest region of the hip, and there's two sub-regions, I guess you call them, the ala and the body down below here, the body of the ilium. Gluteal lines, attachment for those large rotator muscles, the gluteus maximus medius. So gluteal lines there, involved with muscle attachment. If we look at the anterior iliac spine, right up front here, if there's an anterior, superior, then hopefully there's an anterior, inferior. So there's two paired spines, in the front and in the back. In the front is where we sometimes get that hip pointer injury. You can see right here in this example, often from a collision or from a fall. Moving to the ischium, which is the part we sit on, there are notches. Well, really the greater sciatic notch is part of the ilium. The lesser is the ischium, and I mentioned earlier that's where some blood vessels and nerves are going to pass by there. Here's a good view down lower right of some of these, especially sciatic, the largest nerve in the body there. Ischial tuberosity rough, where we sit, and so that's why sometimes, I'll put this image here. If we sit too long, the roughened area is going to dig into the connective tissues in the gluteal area. Largest foramen, the obturator foramen. Even though it's large, there's an obturator membrane that covers most of it, except where some nerves and blood vessels pass through. Lots of words here, but let's just look. We're looking at the pubis, inferior, anterior with the superior, inferior ramus. Okay, there's a lot of words there, but if we remember ramus just means branch. So you notice that the pubis has two different branches that connect it to the ischium. That's all we're saying here. So here's a ramus, and there's a ramus, connecting it to the ischium. You see how sometimes these words, if we can just get it straight, this is the superior part of the pelvis. It's up above. This is the inferior posterior part because it's in the back, making it posterior. And here is the inferior, because it's below, anterior part. And it's good to get these words straight kind of early, because then all these little words like posterior, inferior, iliac spine make sense, because you're holding the bone in your hand and there's a pointer here, maybe on a test, and it's saying, what is this part? And you can say, well, look, see the pubis points forward, so this is anterior, this is posterior, and that's the spine. There's two spines. This one's up top, that must be the superior, this must be the inferior. And so you're not left trying to memorize every single word individually without meaning. Okay, so work on that. Work on kind of getting the big picture, and then work your way down to the little stuff. I mentioned symphysis there. Late in the pregnancy, the relaxin hormone, good term for that word, because it's going to soften that cartilage and some of the ligaments, and so it changes. It makes delivery easier during childbirth, but it changes the way a pregnant woman walks in her late pregnancy. She kind of waddles, but we never want to make fun of her for that. She can't help it. Acetabulum, that's the hip socket we looked at in the video. There's a notch on the inferior end, which is below, where blood vessels and nerves are going to pass. And there's also an attachment site for the head of the femur here. I like this picture here because I'm not going to ask you to memorize all this here. We'll look at it later. But it's such a beautiful joint. Hip fracture is often associated with age, so lower right. If as we age, we're going to borrow calcium and other minerals from our skeleton, and so we tend to lose mass as osteoporosis. Hemiarthroplasty is one surgical procedure that replaces maybe the femoral head here, or it may reconstruct part of the acetabulum. But often now just a total hip is put in, a prosthetic. Lots of lines here, and this is rather important because this is the pelvic brim, and it's going to be the topic of several slides. The line begins at the sacral promontory. Okay, so here's the sacrum, and laterally it's going to run along near the arcuate line. There was a picture of the arcuate line on an earlier slide. Then the pectineal line. Sorry, my pointer. There it goes. Pectineal line. And then finally to the crest of the superior portion of the pubic symphysis. Superior meaning above, so it's the top part there. Now above this region is the false pelvis. And it doesn't mean it's fake. It's a term, or greater pelvis if you wish. I prefer greater. And this is where the part of the urinary bladder and the intestines, uterus. Now the true or lesser, I'm down in this last part, is below, and this diagram lower right may seem confusing at first, but just take a moment. Here's the sacrum. We know what that is, yeah, sacrum right here, right in the center. So we're seeing a lateral view, and then here's the coccyx. It's curving inwards, makes me think this is a male. There's a true pelvis down below and above the false pelvis, so that's why you're going to have the vagina, the cervix of the female, the prostate of the male, down a little lower in this region. Pelvimetry is how we measure the inlet and the outlet. So let's take a look at this for a minute. Here is the inlet. It's the superior opening of the true pelvis. If you remember the arcuate line, pectineal, and so forth. There's the inlet. The outlet, as you might guess, is lower right, and that's as if you're looking up through the pelvis from down below. And this axis is an imaginary line that curves through the. Oh, here's a nice pelvic inlet here. We use the pelvic axis and the inlet to determine if there's going to be problems during childbirth, because the baby's head has to pass through the pelvic axis in its descent from this inlet down through the outlet here. Well, how do we tell men from women if we find a skeleton out on the desert? Maybe it looks old. There's many ways, and some of them are a little bit shaky or sketchy, you might say. And they're often due, at least in the pelvis, due to childbirth adaptations to this process. So let's take a look at these. The pelvic brim, I've hit you with this several times. Arcuate line, pectineal. There's the superior pubic symphysis. So here's that pelvic brim. On females, it tends to be wide and oval. Males, somewhat narrow and heart-shaped. Considering the bulk of the pelvis, there's kind of a small opening. Acetabulum, that's the hip socket. In women, it tends to be small and anterior facing. Anterior means forward facing. In men, tends to be a little more lateral facing and large. It might be partly to accommodate our heavier bodies. Obturator foramen, the biggest hole in the body, is going to be oval, which you can't see in this view very well. You have to be holding the bone in your hand. I mean, that's why I added these. You can sometimes see it with a real bone, whereas the picture doesn't always give you the best indication. Pubic arch, look at this, really wide for a female and narrow or low angle for men. Iliac crest, I like this one. Usually the women, the iliac crest is fairly flattened and wide, whereas here almost shaped like an auricle or ear structure. Ilium, it's less vertical in a female. So see how it's wide and low? I would not say vertical, I'd probably say tall, but vertical is a good technical word. See the men, fairly tall. Greater sciatic arch, look down below, and you'll see that. See that? There's a female. There's the male. Much wider in a female, the sciatic arch. Oh, excuse me, the notch. And the pelvic outlet. Here we have it in the female, nice and wide. The male. We somewhat talked about this already, but you can see it's round. There's no better way, though, than to have these bones in your hand and roll them around, look at them at different angles. A little review here, just so we know what's going on. Sacrum, part of the axial skeleton, so the spinal cord's coming up through here. There's the attachment to the coxal bone. Ilium up top. Ichium in the front. Pubis. Think of pubic bone or pubic parts. Ichium in the back that we sit on. The spines, inferior, superior. The gluteal lines are going to be in the back. This is the medial surface. Here's the pelvic brim. Arcuate line, pectineal, ischial, superior ischial symphysis. Obturator foramen. Acetabulum, where the head of the femur is going to fit. You see, it's not so complicated. Spend some time. I think you'll find it's a lovely part of the body. Okay, good luck with it. Thanks for listening.